Here at Smilo Cancer Hospital and at our care centers throughout the region, providing high-quality care and keeping you safe during your cancer treatment is our top priority. High quality means consistently providing exceptional care. Keeping you safe means having in place and following the procedures necessary to avoid mistakes and errors that can potentially cause you harm. Safety is especially important when it comes to preparing and administering chemotherapy and immunotherapy treatments. Safety requires all members of your healthcare team working together, and as the patient, you are the most important member of the team. We'd like to use this video to describe the procedures we have in place to keep you safe and at the same time give you an idea of what to expect when you receive your cancer treatments. The procedures apply to all chemotherapy and immunotherapy medications that you receive. Regardless of how long you are on treatment, these safety steps will be followed every time and at every location across the Smilo Cancer Hospital delivery network. The first element of our safety procedures occurs even before your actual treatments start. Your treatment plan is entered into the computer only by your primary oncologist. That is, the cancer specialist who knows you well and is responsible for making your chemotherapy treatment decisions. Your oncologist usually enters the plan before your first day of treatment, or what we call Cycle 1. This treatment plan is the one that you discussed with your oncologist and agreed was right for you. Your oncologist will also ask you to sign a consent form before you begin your treatment and whenever you start a new treatment regimen. Your treatment plan is made up of cycles. A cycle means a period of treatment with chemotherapy and medications to prevent side effects, followed by a period of rest or no treatment. Each cycle also includes pre-treatment blood work and other tests to monitor how you are responding to the treatment plan. Treatment plans are like a complex recipe with instructions for each cycle. These instructions are also referred to as orders. Like a recipe, they are exact instructions for pre-treatment blood work, for the specific medications you'll be receiving, and how they are to be given. On the first day of each treatment cycle, you will be seen and examined by your oncologist or another team member, such as an oncology fellow or an advanced practice provider, sometimes called an APP, meaning a nurse practitioner or physician assistant. If there are no abnormal findings and your blood work is in an acceptable range, your oncologist, fellow, or APP clears you for treatment and you will head to the infusion area. During all steps of your infusion, nurses and pharmacists will use a procedure called independent verification. Independent verification can be thought of as a double and triple check on the treatment plan orders. They are called independent because two clinicians separately, alone and apart from each other, check the instructions and then compare results. The results must match and make sense in order to proceed with treatment. This separation ensures that each clinician thinks for themselves and removes the opportunity for another person to unintentionally influence what they read or hear. Two people are unlikely to make the same mistake if they work independently. You may be wondering why it is necessary to double-check the doctor's orders. Basically, these safety steps are standards to prevent medication errors that the American Society of Clinical Oncology and the Oncology Nursing Society require of all cancer centers and oncology practices. There are 3 points at which independent verification is required: prior to medication preparation, during medication preparation in the pharmacy, and right before your medication is administered. Before your medication is prepared in the pharmacy, on each and every day of your treatment, 2 nurses independently double-check the orders entered by your oncologist. Note that in some circumstances, this may be a nurse and pharmacist. The nurse that will be treating you first checks that your weight and height are accurate, reviews results of your blood work, and assesses that you are not having any side effects that would prevent you from being treated. Your treatment nurse then checks that the medication dosages are calculated correctly, that the order includes the correct administration route, meaning, for example, by IV, injection, or pill, the correct length of time, and the correct treatment date. The nurse also checks if there was any change in your dosage from your previous cycle of treatment, if one was given. A second nurse independently checks all of the same information. When the check is completed, the second nurse signs a verification in the medical record to attest that the order is correct. If either nurse finds a difference in what the oncologist has ordered or finds an incorrect order, the nurse consults with a doctor or oncology pharmacist. Once this first verification is completed, your order is sent or released to the pharmacy for preparation. The oncology pharmacy staff are critical members of your cancer healthcare team. An oncology pharmacist is an expert in medications used to treat cancer and is an invaluable resource to doctors and nurses. The oncology pharmacist reviews your medical record and checks that the treatment plan chosen by your primary oncologist is correct for your diagnosis and stage. They check that all of the medications that you are currently taking are compatible with the treatment plan medications. They also work with the business staff to assure your cancer treatment plan is approved or authorized by your insurance. Working independent of the nurse, the pharmacist performs the same safety checks and dose calculations that the nurse performed earlier. The pharmacist also oversees the activities of the pharmacy technicians who are highly skilled in preparing cancer treatment medications. Once the pharmacist verifies that the order is accurate, the order is electronically sent to a computerized IV compounding system called DoseEdge to spell out the exact instructions for the pharmacy technician to prepare your medications. DoseEdge generates a label which prompts the technician to gather the ordered medications and needed supplies, like IV bag and tubing. The supplies are passed into the controlled environment clean room through an air-sealed window. All medications are prepared in the clean room using state-of-the-art equipment, which assure the sterility of the medication and protects the pharmacy staff from any leaks or fumes. Every step of the preparation process is photographed and barcoded to assure the right drug, dose, patient, time and frequency, and administration route. Also, we have a record of every step of the process. Once prepared, the medication is checked by the pharmacist by reviewing all of the photographed preparation steps. Then, a final dose label is applied with the barcode that the nurse scans right before administering your medication. The whole pharmacy preparation process usually takes from 30 to 90 minutes. However, this time frame may vary depending upon the complexity of your treatment regimen. You probably wonder why your medication cannot be prepared ahead of time. The answer is that as you go through your cancer treatment, your dose may need to be adjusted or your treatment rescheduled if you experience any side effect or change in your medical condition. The third and final independent verification check is right before your treatment is administered. Your nurse will inform you that your chemotherapy is ready to be given and will ask you to turn off any electronics, not use your phone, or speak to others with you during this check, so that you, as a team member, may participate fully in the verification process. You will be asked to state your first name, spell your last name, and tell us your date of birth. The nurse will tell you the name of the medication you will be receiving and will describe what you may experience during the infusion or injection. Then, your nurse will silently check that the medication label on the IV bag, syringe, or pill matches the information in the computer and your ID bracelet. The nurse will program the pump if needed for the infusion and call in a second nurse to silently perform the final independent check of all of the same information and pump settings. As before, if their check doesn't match, your nurse will notify the pharmacy for clarification and correction before starting treatment. We hope you found this video helpful in answering some of your questions and preparing you for what to expect. We understand and appreciate that this can be a challenging and sensitive time for you and your family. You can trust that all of us will do everything we can to keep you safe and comfortable during your chemotherapy or immunotherapy treatment. We thank you for choosing Smilo Oncology for your treatment, and we are honored to be part of your healthcare team.